Hello, guys. Welcome to Dr. Sadat Medical Hubs, your trusted source for clear and practical health guidance. Your health is our priority. Today, we are going to talk about a condition that takes millions of lives each year: heart attack, medically known as a myocardial infarction or MI. We'll break down what it is, why it happens, who is at risk, and most importantly, the proven steps you can take to prevent it before it happens. By the end of this video, you will have the exact lifestyle and medical strategies that can protect your heart and save your lives. Prevention isn't just possible, it is powerful. What's heart attack? The definition. A heart attack or myocardial infarction is the death of heart muscle tissue due to prolonged interruption of blood supply to part of the heart, usually caused by blockage of coronary artery. What does the definition mean? A heart attack happens when blood flow to a part of heart muscle is suddenly blocked. Most often, this is caused by a blood clot that forms on top of plaque deposit in the coronary artery. Without oxygen-rich blood, part of the heart muscle begins to die. This is a medical emergency. Every minute counts. The earlier the treatment, the better the chance of survival and recovery. What are the etiologies of MI? The main cause of a heart attack is atherosclerosis, a slow build of fatty plaques inside the arteries, but it doesn't happen overnight. Years of smoking, poor diet, high cholesterol, uncontrolled blood pressure, lack of exercise, and chronic stress all contribute to this build up. Sometimes the trigger is sudden, like intense physical exertion, emotional stress, or even extreme cold weather, which can cause a vulnerable plug to rupture and block the artery. So the other causes are plaque rupture, coronary embolism, severe hypotension, coronary artery dissection, increased oxygen demand. So, what are the risk factors of MI? The risk factor for heart attack or MI are divided into two groups: modifiable risk factors and non-modifiable risk factors. First one is modifiable risk factors. The ones we can change: smoking, that we will discuss in the prevention, high LDL or called bad cholesterol, low LDL or called good cholesterol, high blood pressure, diabetes, obesity, physical inactivity or a sedentary lifestyle, unhealthy diet we can add, stress and poor sleep. Non-modifiable risk factors are the ones we can't change: age, men over 45, women over 55, family history of early heart disease, male gender. The good news is that most heart attacks are linked to modifiable risk factors, meaning lifestyle change can have a huge impact on the heart attack. The symptoms of MI are divided into two types: typical, atypical. Typical symptoms include chest pain or pressure, often spreading to the arm, neck, jaw, or back, shortness of breath, sweating, nausea or vomiting, dizziness or lightheadedness. But remember, some people, especially women, diabetics, and the elderly, may have atypical symptom, that is the second part. What are the atypical symptoms? Nausea, fatigue, anxiety, feeling of fullness, shortness of breath, not feeling right. Never ignore unusual or persistent symptoms. It is better to be safe and get checked immediately. Chest pain is one of the most common reason people seek emergency care, but it is important to know that not all chest pain is a heart attack. Doctors think in terms of differential diagnosis, looking at all the possible causes before making conclusion. First of all, cardiac causes include angina, acute coronary syndrome, aortic dissection, and pericarditis. These conditions directly involve the heart or major blood vessels and often require urgent medical attention. Second, respiratory causes such as pulmonary embolism, pneumothorax, and pneumonia can also cause chest discomfort, often with the shortness of breath, rapid breathing, or coughing. Third, gastrointestinal causes like esophagitis, esophageal spasm, and peptic ulcer disease can mimic heart pain, but they originate from the digestive tract, sometimes triggered by acid reflux or food. Number 4, other causes gastric arthritis, rib fracture, herpes zosters, depression, and anxiety. Even anxiety, even anxiety or depression, which can reproduce real physical chest pain because the causes range from mild to life threatening. You should never ignore knee or persistent chest pain. Get checked quickly. The right diagnosis at the right time could save your lives. Now that you know what a heart attack is, why it happens, and how it presents, the next question is, how do we stop it before it starts? In our next video, we will deep into the prevention. From primary prevention to keep your heart safe from the very first day, to secondary prevention if you have already had heart problems. We will share simple, evidence based lifestyle changes, medical strategies, and daily habits that can literally save your life. So stay with us. Your heart deserves the best protection.